Hi everyone. So today we'll be discussing the process of registering with the CQC for domiciliary care providers. The guide will cover everything that you need to know, all of the steps to ensure that you're compliant and also meeting all the regulations. Registering as a domiciliary care provider can be quite a daunting task, and you might not know where to begin. It might be something that's in the early stages of development. You've just been thinking about it, and you're just not sure where to start, what qualifications you might need, what needs to be in place before you even start the CQC registration. So hopefully by the end of today's webinar, we'll be able to put your mind at ease. You'll have a starting point and also feel like you've got a bit of support and know what to do along the way. So let's get started. So the CQC, they set out the regulations with the Social Care Services for England, and they ensure that you as providers meet high standards of care. So registration is really important for you. You're not allowed to carry out any services until you are registered. So that's something to consider. And you need to ensure that you're meeting the highest safety and quality standards. It also builds trust with your clients and it protects the service users by holding the provider accountable for their care. So it's really important aspect. If you're thinking about starting up a domiciliary, you need to really have considered what it takes to register with the CQC, okay? So starting with the application process to become a registered manager or a new provider, it involves several really important steps. Before applying, you'll need to set up your own business structure, choose whether you'll be operating as a sole trader, a partnership, or a limited company, and you'll need to register your business on Companies House. So before you can start your application, these are things that need to be in place. So have you thought about, is it just yourself or is it a family member, business partner that you're doing this project with? If so, when you register on Companies House, you need to ensure that the relevant people are named on Companies House, as well as the correct business structure. You'll then need to decide who is going to be the registered manager. So choosing your registered manager, it could be yourself, or you could appoint somebody else that maybe has the relevant qualifications and the experience to meet the requirements. So you're the provider, somebody else is the registered manager. There's absolutely no problems with that. But we'll go on to what it takes to become a registered manager a little bit later to see if perhaps you are the best person or you should hire somebody for that role. When setting up the business, of course, you'll need to register the company on Companies House and you'll need to have a location for that aspect of the business. But you'll also need to have a location for your office. Now, as domiciliary care provider, it's not as though you provide the care from a set location. But when we talk about location, we're talking about the office location. So you need to decide and find a suitable place for your administrative work and your record keeping. So this could be where you store your care plans. It could be where you store your recruitment documents. It should meet the health and safety standards. And things that you should consider is that the location, so the office location, is secure, that you have CCTV, that nobody has access to any confidential data. In some instances, you may operate this from your home address. If that is the case, the things that you should consider is, have you got the permission from the landlord if you're renting? Does your mortgage cover the insurance for a business to operate? You'll also then need to get your insurance cover taken out before, again, you can start your application. So if this is something that you're thinking about, these should be the main considerations at the very beginning of your project, okay? You'll also need to create a business plan. So business plan is essential. So a solid business plan is necessary and it should outline your company's overview, target market, the services you're going to offer, pricing structure, financial plans, and any marketing strategies as well. So a really good business plan is going to get you onto the right tracks. You're going to be very prepared, and you'll also need this as part of your application to show that you've actually thought about these things. A little later on, when it comes to your registered manager nominated individual interviews, You'll also have to discuss financial forecasts, financial viability. So the business plan is really important at the beginning. It's something that you would need to think of yourselves because it is your business. You might want to have the help of an accountant that can help you with the numbers and the figures. But essentially, it's something that you should be thinking about right now if you're thinking of opening up a domiciliary care service. Once you've done that, before you can start a CQC application, you do need to ensure that you've got a DBS check. So this needs to be an enhanced check. You can do this via the CQC. It just needs to be an enhanced DBS check and it needs to be valid within the last year. Without a DBS check, a valid DBS check, you will not be able to start your application and it will be rejected. So if you've got a DBS check at the moment, do check it, check the dates, the validation. If you haven't, I would strongly suggest that you start the process because it can take a few weeks, okay? So, what does it take to become a registered manager? So, we discussed already that it can be yourself or it can be somebody that you bring on board to take on the registered manager aspect of your registration. So, to become a registered manager, you would need a few requirements. And I always get asked this question. I'll have a call and it'll be somebody who's thinking about opening up their own domiciliary service. And they ask me, okay, so what qualifications do I need? Can I start this myself? So let's go through some of the key requirements that the CQC would expect for you to have whilst doing your application and submitting it with your application also. So the registered manager is responsible for the day-to-day management of the service. Some of the qualifications that the CQC would expect for you to have would include a level 5 diploma in leadership and management for health and social care. This is a minimum qualification required, and if you don't hold it or have one of these already, it's okay. What you can do is you can sign up to a course whilst you're doing your CQC application, and you can provide the evidence that you are on a accredited course, and that you do intend to finish it before you start complete your application. So that's absolutely fine. So some of the other experience that the CQC would expect you to have would be some experience in management in a role of health and social. So it's typically required. Experience in domiciliary care would be highly preferred, naturally, because you'd understand what it takes or what needs to be delivered within that setting. And a really strong knowledge of Health and Social Care Act and, of course, the key lines of inquiry when it comes to the CQC. Leadership and staff management skills are essential. Knowledge of safeguarding, financial and operational management experience, and a strong understanding of person-centered care. So you should be able to demonstrate that you have either the qualifications, experience, both in an ideal world, and this needs to be relayed to the CQC, okay? For the nominated individual, it's not too dissimilar from the registered manager. Again, we would expect that you'd have a formal qualification. That would be a level 5 diploma. You'd also have a proven track record of senior leadership role. The skills and knowledge that we would like you to have, or the CQC would like you to have, would include strategic management skills, knowledge of governance, risk management, and quality assurance. The ability to liaise with the CQC commissioners as well, because you'll be the first point of contact between yourselves, so the service that you provide, and the CQC. So that's something that you would need to have in place as well. So the key overlaps for both of the roles, so they include, as we've already mentioned, so just as a bit of a summary, our leadership and management experience in social care, a strong focus on regulatory compliance. You must pass the fit person test conducted by the CQC, which evaluates your character, experience, and qualifications. And ongoing training is vital. So how do you prepare? So you've decided this is sounding great. This is exactly what I want to do. you've looked, you've got the relevant qualifications, you've maybe already set up your company's house registration. So the ways that you can prepare, so if you haven't already, obviously do the level 5, build experience. So work in a leadership role in a domiciliary care setting or something similar. This will enable you to get the relevant management experience. So not only is it going to be good for your application, but when it comes to the day-to-day running of the service, it's really going to help you because you're going to see from frontline what it takes to kind of run a domiciliary care providing service. It's really important that you understand the CQC standards. So you really should be familiarizing yourselves with the key lines of inquiry. And by that, we mean is your service safe, effective, caring, responsive, and well led. As mentioned before, you must apply for your DBS and this must be cleared. And then you would prepare for your application. So there's a lot we've already discussed and a lot that needs to be in place before we even get to the stage where we can start doing an application. So if this is something that you've been thinking about and you want to start the process, once you've got all of these documents, then is the time to start the application. If you have bits and bobs of the requirements that we need, it can delay the application. So it will just sit there and we'd have to wait, or you'd have to wait until you've got your DBS clearance, or you'd have to wait until you've got the insurance. So once you've gathered all this information, you're in a really strong position to not only do the application with ease, but it'll be a lot quicker because there won't be any discrepancies or any excuse or reason for the CQC to maybe reject the application, and then you'd have to start it again. So the simple steps that you can do to prepare for your application is to gather the documentation. So start by collecting all the necessary documents that you need to submit your application. You would then complete the application. Now, there has been recently a lot of confusion about CQC applications, how you submit them, submitting them on a portal, and then we were submitting them on a paper base. So as of today, due to ongoing issues with the CQC provider portal, the process for submitting an application is that you would submit it on paper form. So you would get the application form via the CQC and you would submit it to them by email. So the reason that is because there were many, many issues with the CQC portal. A lot of people were unable to submit. There was internal issues where things were being rejected, returned, and the process wasn't really good with the CQC. So they paused on the applications via the portal. So for now, it's recommended that you do the application via the paper forms you can find online and you submit the application. So to prepare for the actual application, there's a lot of documents that you need to submit alongside. So a lot of supporting documents. So these are things like your safeguarding policies, your health and safety, risk management. So there's a lot that you need to have ready when doing the submission of your application too. So it's not just a case of getting the initial documentation. Once you're at the application stage, there's a lot of supporting documents that you need to attach with your application, okay? So some of these supporting documents, as I mentioned, that are essential and your CQC application will not be looked at. It will definitely be returned until you've got the relevant information. It includes your safeguarding policy, your whistleblowing policy, recruitment policy. You'd need a care planning policy because that is specific to your sector, medication handling policy, your person-centered policy, your health and safety policy, data protection. You can see the list goes on and on. Complaints policy, quality assurance and feedback. So these are just some of the policies that you need. Now, what we find, and we do a lot of these applications, is if the policies are not really, really tight, watertight, and it's not been customized, so if it doesn't have your information, for instance, if we talk about the safeguarding policy, it should state who the safeguarding lead is, who the local authorities are, what the process is. Sometimes we find some providers are just submitting very bog standard, shall we say, policies that haven't been fully customized and therefore being rejected. So it's important that you take the time to review any policies. If you're getting templates from third parties, which isn't uncommon, that you're reviewing them and making sure they've been customized for you. Otherwise, all of this will be rejected. Another key thing to consider is that you should have the date that the policy was created, the date it was reviewed, and then follow up review dates. This is important. Otherwise, again, the policies will be rejected. So, in addition to the policies that we've just mentioned, you'll obviously need to complete the application form. So, you would have a new provider form and your registered manager's form as well. So, if it's yourself that is covering both aspects, amazing, then you can just duplicate the information. If you have somebody else that will be taking on the registered manager side of things, then you would need a whole application for that individual. So you would need to make sure that you've got all of the qualifications for that person. They've had their DBS check. You've got a employment history from the age of 16. They've got the relevant references. So there's a lot that needs to be in place. So if you're thinking of starting the registration process, it's essential that you decide who will be the registered manager, the new provider, nominated individual, and you start collating all that information for each of the people that will be named on your application. So you'll also need to have a statement of purpose. In your statement of purpose, you'll outline your what you intend to do as a domiciliary provider. So, for instance, we will cover North London. We will start by seeing 5 residents. Our aim is to provide high quality of care and grow the company by doing X, Y, Z. So that's something else that is really important. Your statement of purpose, and again, that's something that needs to be very customized to yourself, not something that you should necessarily be using a template for, because of course it needs to be specific to what you will be providing. So the timeline for the application. So we've mentioned all of these documents that you need to have before you consider the application. We've discussed all of the supporting documents you need for the application. Once you've got all of this information, you'd fill out the application and you'd submit the application. Now, this time frame is in an ideal world. There's a lot of times where you may want to start the initial submission, but you lack the DBS. So doing the DBS check might add on another 2 weeks. By the time it's been processed, you've got your certificate. That's going to delay the whole time frame. Once you've submitted the application with all being well, it will go into validation stage. Again, this is like the best scenario time frame. We have seen recently that the applications can take 3 to 6 months. So if this is something you are considering, it's really important that you start getting the ball rolling now to delay delays for yourself opening up your service, because naturally you can't see any service users until you've got your application. So once it's been reviewed by the CQC, they will hopefully validate it. Once it's validated, they will invite you for a registered manager, nominated individual interview. They usually give you about 2 weeks notice during this process. It's ordinarily done via a Zoom link or a Teams link, and it will be over a video call. Now, in February, we do have a webinar that's dedicated to the interview stage, where we will talk about scenario questions and some sample questions and answers. We also do have pre-recorded videos on our YouTube, which are really, really handy. Lots of people have come to us and said how helpful they have been. We also provide support for you for interviews. So if you're at the stage where you've already done your application, you're nervous about your interview, please do reach out to us. Now, once the application has been accepted, you've done your interview, it will move on to the decision. So here we've just got a breakdown of what to expect. So the initial submission, so we're going to prepare and submit the application. Along with this, we've sent our qualifications, our DBS, our insurance documents, policies, procedures, financial viability. It's gone to validation. After the submission, they're going to review your application. The CQC will contact you. Sometimes they might need additional information or clarification. Don't be alarmed by this. It is quite common that they'll say, thank you, you passed validation stage, but we need X, Y, Z till we can sign it off. This is sometimes the case as well after your interview, where in order for them to sign off and give you a registration, they might just need further information or an additional document, let's say. So you'll then have your interview. The interview, once you've had the interview, it typically takes about 10 working days until you get a answer or your registration will come through. There are times when perhaps there is an inspection of the premises, and they would arrange that with you as well. And yeah, so the decision will be made once all the required documents and the inspections are completed. You will usually get an approval. So if everything is in order and your application meets the standards, they'll approve your registration. Sometimes there are conditions or concerns. So if there are, the CQC will write to you and they will outline the areas in which perhaps you need to give them further information or documentation, or during the interview, if they felt that you weren't suitable for this role or suitable to gain the registration just yet, they would usually, during the call, stop you, suggest that you withdraw. If you decided you want to continue, you can continue. And at the end of the interview, they will send you a report which will outline the areas that they felt didn't meet the criteria. You will then have the opportunity to appeal, or you can withdraw and you can obviously register at a later date when perhaps you've done further training or got more knowledge on the CQC, for instance. Okay. So the ongoing compliance. So once you're registered, and we're hoping that the CQC, the whole process goes really smooth. They validate your application. They've done the interview. You've smashed it. They've given you your registration. Now it's your time to start ongoing compliance. So once registered, maintaining compliance is crucial. We always recommend using a digital care management software. This is going to help you track things like your care plans, your staff training, incident reporting, medication management. Now, during your interview, the CQC would have asked you what systems and processes do you have in place. If you can give them the assurance that actually we have a digital software or such like in place, this automates and reminds us to do tasks like our 6 monthly audits. We get reminders when our CPD is due for our training. It prompts us to do our appraisals once a year. It's going to really benefit you, not just during the interview, but your ongoing compliance is the time where you need to prove everything that you had said during your interview or within your application, you're going to meet. Now, you will be re-inspected at a later date. This could be 1 year, 2 year, 3 year down the line. And what they're doing is they're coming to seek all the evidence that everything that you set out to do, you are doing. So you do need to have that readily available for the CQC. Now, an automated system, we have one, it's called the Smart Healthcare MediComply software. It's really great. So we'd get you set up, we'd automate all the tasks that you need to do. So it would tell you what you need to on a daily basis, weekly basis. Click on it, e-logs will pop up, submit the information, it stores it for you. And when it comes to your CQC inspection, so at a later date, you've got all of that historic evidence stored that you can show the CQC, and it's going to show them that obviously you've committed to delivering high standards of care. If you are already registered, of course, we can set up a demo of this software. If you aren't registered and you're looking at applying and you just maybe need some further guidance or you're unsure of where to start, you can reach out to us anytime. But that kind of brings us to the end of today's webinar and everything that we needs to be in place just for the application process. So yeah, thank you so much for joining. Just to give you a bit of an idea of what's coming up soon. So we have just started a webinar series. So our webinar series will be once a month. It will cover everything to do with CQC, whether that's interview prep, applying for registration, ongoing compliance. So do keep a lookout for that. If you've watched our webinar, I know it'll be on YouTube, so you might be watching it at a later date, but we do offer in-person workshops. So you may have listened to our webinar today and you think, wow, where do I start? What do we mean by safeguarding or anything like this? We do offer workshops, so 4 workshops where we cover all the regulations, key lines of inquiry, how to ace your interview, how to maintain compliance afterwards. And our next one is on the 7th of March. So if that is something that you're interested in, that's in London. And then we also have an upcoming event in Leeds, and that's towards the end of the month. But it's been amazing. I hope it's helped you to give you a bit of an idea if setting up a domiciliary service is right for you. And we're always here to support you. So if you have any questions or need any assistance, do just drop us a call, email us. Watch out for our upcoming webinars, and hopefully we'll see you soon. Take care. Bye.